Digital X-rays are great. We love them for a lot of reasons. They're unlike the old school X-rays, or the analog is what I call them, which were these they're little squares about that big. And we would put those in, and we would take the picture, and then we run them through a bunch of chemicals. It takes about 15 minutes to run it through this machine that's actually running them through different chemicals. And then when it comes out, we're walking around holding that up to the light, and then I'm trying to show it to the patient, and it's very difficult for them to even see it. I mean, even when I would put it on a view box, which is a lighted box, so that I could see that, sometimes I would use a magnifying glass to kind of see what I was looking at. But digital X-rays are much better because the first thing that happens is there's much less radiation. We can turn the radiation level down to about a third of what it was whenever we were taking, because the little sensors, the electronic sensors, are much more sensitive than trying to run enough radiation through the tissue in order to expose the old school plates. So that's the first advantage of it. The other advantages would include it's almost instant. Within about 7 seconds, it comes up on a monitor in front of the patient right there. And then also on that monitor, we can blow it up about 35 times the size of what it used to be. So now not only do I get it in 7 seconds, but I've got it right there, and I can sit there in the chair and I can say, well, you see this and you see that, and it's an education tool, and the patient understands it. Especially a person who's not already feeling. I mean, a lot of times people come in and say, doc, nothing's bothering me, but there's stuff going on. I mean, you can have high blood pressure and not know it. You can have high cholesterol and not know it. And those are problems, and you don't feel those things. But those are important things to know about, So it goes for dentistry as well. There was a gentleman this week who came in, and he was a new patient, and he came in and he had no pain, and his teeth looked pretty good. His gums looked pretty good, but he had a tooth that had a crown on it. And on the X-ray, you could see there was a round, dark spot at the tip of the root of that tooth. Now, he had no pain whatsoever. But that's an abscess, and we know that that's an abscess. I know that that's an abscess. And a couple of the things that could happen is that any day he could wake up in the morning and look like he had eaten a softball or grapefruit. His whole face could be swollen up, and that can happen overnight. We see it all the time. People go to bed, they're fine, they wake up in the morning and their face is huge. So, and that can be life-threatening. A lot of people don't realize that, but people die of dental abscesses depending on where they are, so they can be life-threatening and they can be very, very emergent. He was able to see that. He didn't know that he had that problem. And when I showed it to him on the X-ray, now of course you can't take a picture of that because that's in the bone, but when he saw that, he was very motivated to go get that squared away as soon as possible, because when you see that on there, you know that that's pus in the bone, and it takes a while for that to show up on the X-ray. So there's already been some damage that's been done. But that happens on a daily basis, when people see these things. And I think that's the benefit of the technology. I mean, we just invested in this new technology a year or two ago, and we've been trying. I try to stay on the leading edge. I try to wait till things are well proven and safe for my patients. But once that I feel like there's a green light, I really try to invest back into the practice in order to make things safer and more efficient and easier for the patients to see and understand and take care of their teeth. So that's the advantage of digital X-rays. We love them for all those reasons, especially because we can decrease the amount of irradiation and we get them instantly. Those are two things that I love, but then it's also nice to have them up on the screen as well.